I want to spend just a minute talking about kidneys and hearts together, because it's a big deal that when you're eating animal protein, you're actually attacking your kidneys. And I'd left this out of my talks for decades, knowing, because I had written one of the original articles on it a long time ago, but it's time to put it back in, because the data is so overwhelming that when you eat animal protein, it's toxic to kidneys. It increases the progression from chronic kidney disease to kidney failure and going on dialysis. And people do not generally die of kidney disease. They die of heart disease when they have kidney disease. And so red meat increases the risk of going on dialysis. The data is very clear. And so we add that to our list of many things of why people shouldn't be eating red meat. So diabetes, stroke, sure. Heart failure, sure. Let's add kidney disease to that list. We have multiple mechanisms. One, if you want to do a screen capture, one of them that we should point out is heme iron, because you now see that in some of the plant-based milks or plant-based meat, particularly the Impossible Burger, and hopefully they'll change that. I know that's what makes it taste bloody and that makes it test well, but it isn't particularly healthy, because heme iron does increase plaque. It produces plaque and then upsets plaque, makes those plaques unstable. I'm going to spend my last minute before opening it up for questions talking about doing an intervention in our community. And I was very privileged to work with President Obama's old church about trying to implement our ACC guidelines, fruits and vegetables, nuts, whole grains. We skip the fish, of course, because we know that that increases mortality a smaller amount, but it still does increase mortality. Trying to replace all the saturated fat, get rid of the sodium and cholesterol, and avoid the processed meat. And of course, there's no trans fats in the United States, hopefully anymore. That nutrition intervention actually went pretty well. We asked people to go on a vegan diet that we supplied them for 5 weeks and just watch what happened. Their insulin levels fell, their TMAO levels fell, their LDL cholesterol, the bad stuff, went down substantially. Blood sugar, their weight, everything. One of the smallest ones was the hemoglobin A1C we talked about for diabetes. That was really highly significant because that little tiny change happened in everybody. It was pretty amazing. So just 5 weeks is all it took. We had pretty good completion rate, really decent adherence, and the risk factors that we measured were so much better that when you put them into our little risk calculator, we found that people were dramatically better. We were actually able to eliminate about 19% of the risk, provided they continued it for a 10-year period. 19% of that 21% increase in risk in African-American adults that I'm always trying to get rid of. We got a lot of press, but what we need is people to really pay attention to the message that is changing your diet will change your risk. I want to please take a capture of this one, if you will. It's the Heart and Soul Cookbook put out by the Association of Black Cardiologists. It came out just a few months ago, and it's a good way to start your plant-based journey. So in summary, as I open it up for questions, we are living in a dual pandemic, no question about it. And we need to advocate for risk factor reduction because those risk factors are leading to the issues that we're struggling with that are cardiovascular as well as COVID. And so please, everybody, think through every food choice that you're making. With every meal, you're determining what your outcome is going to be, and your outcome affects your family and your community and your country. And so, we can spend all of our money on healthcare if we want, instead of education and roads and bridges. But I think it's everyone's patriotic duty to be a vegan. Thank you very much.
Thank you so much, Dr. Kim Williams. That was a lot of information, and many people watching. Thank you so much. It was so much information in such a short time. So thank you for sharing a lot of awareness. With what little time we have left, I have a number of questions, but I saw a consistent question about how many grams of fiber should one consume a day?
So actually, it turns out that for every 6 grams of fiber, that there's like a 15% decrease in mortality. So there should be, I would say, do as much fiber as you can. It turns out that the fiber is actually changing the microbiome. That is, the bacteria that break down the fiber and get the nutrients out of it, those are the good ones. Those are the ones that don't create inflammation. So please, I wouldn't say, how much do you need? I would say, how much can you consume?
Okay. There is just another question I was curious about, because we hear a lot about alkaline diets versus acidity. Can you speak about, are alkaline diets healthy?
Yeah.
And
so,
is that something we should consider?
So if you look at, this is a good one that everyone should do their search engine and do alkaline diet outcomes or mortality or heart attack. You'll see that there's zero data. And so do I turn green with envy sometimes when I see that somebody's got zero data and they're marketing it and making millions? I figure, gosh, I could start that scholarship fund for Chicago Public School to go to University of Chicago if I'd had some idea like that where I could make massive amount of money off of zero data. Because as far as I can tell, there is no data. And you'll probably see that on the, little disclaimer on the little, on all of the supplements, there is no data that this actually, fixes any disease. On the other hand, an acidic diet, if you're talking about the acids of animal protein, that's really important. And people don't realize that dairy has, with that animal protein being buffered by the calcium out of your bones, that dairy can actually worsen your bones. They don't realize the data on breakdown of animal protein so that it's toxic to kidneys, as I mentioned a few slides ago. I'm hoping that everybody will realize that a whole food plant-based diet, not really a gimmick, is what we really should be doing.
Okay, my last question, because I know you have to go, detox. We see a lot of information about detox. Is it important to even start this journey of a plant-based diet with the detox?
So there's a couple of different types of detox, and people are talking about water fasting as a detox. Water fasting actually does have data for weight loss. The problem is that you really have to associate it with a behavioral change, because people will just, they'll lose 30 pounds and then they'll just rebound back to it. Then you're talking about detox in terms of just a whole food plant-based diet. Yeah, well, people should be doing that whole food plant-based diet anyway. Though the other one that people talk about would be, doing, colon cleansing and things like that as part of their detox. There really isn't a lot of good data for that. But I have to say that even though it's something I'm vegan for 20 years, so I probably wouldn't come up with me, but I would say that the more data that we have on the microbiome being important, and there was even it sounds really strange to say this in public, but there was actually a medical study showing that you can improve people's health by infusing the feces of a vegan into a non-vegan. Just for the reason that I was just talking about, that is, they actually do have better bacteria in their GI tract.
Wow.
And so, if this is true, then I'm saying that all these people who've been pushing colonics for years, now is the time to go and get data and actually prove that it works. Because we've done so many things in medicine that made sense, and then they turned out that they didn't work. What's the most recent one? Probably the HDL cholesterol. We've ever heard that that's so healthy for you, and the higher it is. Well, it turns out the higher your HDL cholesterol, the more you have heart attacks. We had that wrong for 60 years. So that's just one of many examples. And I would say, putting oxygen on people with a heart attack, totally a bad idea. And so what I'm saying is that, in God we trust, everybody else bring data. Okay. And so those people doing those colonics, if you're changing the microbiome and making people better, let's collect some data and show that it's true. All right.
Thank you so much for a phenomenal presentation and taking the time with us.
Absolutely. All right. Thank you so much, everyone.
Thank you.
All right. Bye-bye.